And our first guest joins us via satellite from Springfield, Massachusetts. Mr. Stephen Arenstein is the CEO of a company called Somatics Systems. Stephen, welcome to Health This Week.
Thank you for having me.
Now, Stephen, your company, Somatics Systems, you describe yourself as the worldwide center for something called Prime Somatics. You describe that as a groundbreaking, drug-free, non-surgical approach to pain relief. Well, what exactly is Somatics?
Thanks for asking. Somatics, it's Clinical Somatics, also known as Prime Somatics, is a method of dealing with chronic pain and injuries in a different way than people typically do. Rather than looking at strengthening the joint or stretching the joint like physical therapy and a variety of other methods used, we actually retrain the nervous system to control the muscles and joints properly. So rather than making the body stronger, we actually make it smarter, because it turns out that how the brain controls the muscles is a more significant factor in so many of the musculoskeletal injuries that people have trouble with, from chronic back pain to carpal tunnel syndrome to TMJ to shoulder problems, things that people think are arthritis, the whole host of things most of us suffer from.
Well, now, Stephen, your website, somatics.org, refers to a body imbalance caused by stress, misuse, or perhaps even injury. Can you elaborate on that, please?
Yes, that's sort of at the heart of what we help people with. The body, or the brain, and the nervous system is really a learning instrument. It really learns from the moment you're born, whether it's learning mental skills like math or movement skills like standing, walking, crawling, or playing sports. And as we go on in our life, we're affected by stressors, injuries, misusing our body, like using bad chairs and bad desks. And over time, that learning instrument, the nervous system, learns to hold the body in distorted positions and postures. And those distorted positions and postures have a significant impact on health, to the point where things that are considered problems of aging and decay and permanent damage, such as back pain, such as injuries to the shoulders and elbows and joints, actually very commonly are really just the brain holding the body out of balance. So that's what we mean when we say imbalance. The joints are misaligned, basically, and we realign them.
Well, now, Stephen, your company recently announced the launch of an education program which is designed to showcase the success of your Somatics professional training program. Tell us more about that.
Well, the Somatics professional training program is where we generate practitioners to do somatics. So much like you would go to a doctor and get treated for, a cold, someone comes to us if they have a chronic pain, if they've injured their knee, if they have a repetitive stress disorder from their job, and we train those practitioners in our professional training program. So it's like going to med school, but for somatics. And it's 24 months of part-time training that results in practitioners who can treat pains that no other doctors, physical therapists, alternative practitioners have been able to treat like us. Typically within only a few visits, people will see a change in their symptoms or perhaps a complete relief.
Well, Stephen, pain management patients, and really people in general, are searching for alternatives to drugs for pain management, aren't they?
Yes, they are. They are. There's a few reasons for that. I mean, we're hearing now the more medicalized pain treatment gets, the more people are on heavy-duty narcotics, which limit their functionality. We talk to the U.S. military about how veterans come home and become addicted to drugs of all kinds because of their need and dependence on prescription drugs. Furthermore, you can do all the exercises you want, and you can go to all the physical therapists and doctors you want, but as we all get older, as we live longer, people typically find only management at best, putting up with their symptoms a little better with other methods. Whereas with somatics, people are actually, through retraining the nervous system, eliminating the original cause of the problem. So people get better rapidly and they stay better. And they have tools that they can use for the rest of their lives so that they don't just give in to what they think is an inevitable process of aging. Instead, they stay active, they stay flexible and pain-free throughout their whole lives.
Okay, so we're talking about natural pain management, no drugs involved. How about health insurance companies? Are they beginning to cover your treatments?
Yes, some are. We have coverage in sort of a case-by-case basis. Whenever insurance companies learn about what we do, they jump at the opportunity. Because, for example, someone may be on workers' comp and go to other therapies for 6 months or a year and the company will be paying for that, and the insurance company will be paying for that. Whereas people may come to us, and typical treatment time for somatics is 2 to 10 sessions. So someone can have a back pain that's plagued them for 2 years, that's keeping them out of work, and in, say, 2 months or so, they can be done with that back pain 100%. So the cost-benefit for insurance companies is spectacular with somatics, and when they actually do the math on it, they tend to cover us.
Again, looking at some of the things at your website at somatics.org, the company describes clinical somatics as being similar to like a visit to a masseuse or a physical therapist. Can you walk us through perhaps a typical treatment session?
Sure. Somatics comes in 2 forms. You can get hands-on work where the practitioner actually moves and retrains your body with his own movement therapy, or you can do the work at home with some self-care exercises. Coming into an office like you're describing, a client would come in, they would meet with a practitioner. Sessions are about an hour long, so they're a little longer than a physical therapy session, but you have to go to much less of them. As we said, people typically only come a few times. They would meet with the practitioner would assess them, determine a course of treatment over a few sessions, and then for about 45 minutes to an hour they would be on the table, and the practitioner would be slowly moving the client's joints and various body parts, creating basically like a biofeedback loop between the muscles and the nervous system, so that the nervous system can figure out what's wrong with the body, learn how to correct it, and correct the problem right there on the table. So sometimes people get up right off the table after a visit or two with a back pain that after 20 years is now better in only an hour or so.
It's very interesting. Now, what you were talking about doesn't sound too different than, say, a visit to a chiropractor. What's the main difference between a somatic session and a chiropractic visit?
Oh, it's a very big difference between somatics and chiropractic or physical therapy or massage. The client is active. Now, active doesn't mean difficult, because you can have 75-year-olds doing our work. You can have people who are in major pain. You can also have professional athletes. So the movements are very easy to do. They're very slow. They're completely pain-free. There's no needles. There's no injections. But the client is actively moving in a very slow fashion. And they are consciously learning to control by a conscious movement how to change their body. Whereas in physical therapy and chiropractic, typically the client is more passive, and the practitioner is manipulating their joints passively. Or in the case of exercises, they're learning therapeutic exercises, but the focus in physical therapy is typically more strengthening the joints. And it's not really about making the body more intelligent so much as a stronger structure. And what we found is unless the structure is properly aligned, you can pile up all the strength you want, but it would be very much like a house with an imbalanced foundation. The more weight you put on it and the more you pressed on it, the more it would just go further into the ground on one side and have more damage, more rips and tears and decay.
Now, the company has certified somatics practitioners in several U.S. states and in the United Kingdom as well. Tell us about your network. Where can people get more information?
Okay. Well, we've been training people for a number of years now. We actually have a new training program starting on June 20th of next month, or this month. So we're very excited about that, because in only 9 days a person can become trained to start their practice. It takes several more part-time modules to really get working, but within only a few days you can already start working with a client in practice, or if you're already a healthcare practitioner, you can already supplement your practice. Once you complete the training, you become a certified practitioner, and that's the network you described. There are practitioners all over the U.S. and in the United Kingdom, and a few other places throughout the world. You can find all of that information on our website at somatics.org. You click on the practitioner link, and you can look up a practitioner in your area. If you have any other questions, you can call us, because right now, unfortunately, somatics is still not in every area it could be. There are some areas that are underserved. So please call us if you can't find a practitioner, and we can try to get you the best help possible, whether that's self-help exercises or traveling practitioners.
Our guest has been Stephen Aronstein. He's the CEO of Somatic Systems Incorporated. As Stephen told us, their website is somatics.org. Stephen, thanks so much. Interesting concept. Thanks for joining us here on Health This Week.
Thank you very much for having me. It was a pleasure to be here.